This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
Dr. Bill Adams here, No Spin Live. We've got a great Christmas show for you today. We're going to be talking about thigh gap, what some women do for their men, gummy bear breast implants, and freezing fat. And we've got a great crew with us, some superb plastic surgeons that are going to be able to give you their insights and tell you the real deal, starting with Dr. Tiffany McCormick from Reno, Nevada. Tiffany, how are you?
Great, thank you.
Dr. Jason Posner from Boca Raton, Florida. Jason, JP.
What's up, guys?
And last but not least, Dr. Mark Epstein from Long Island. How are you?
Doing great. How are you?
All right, so guys, this is a Christmas edition. You know, we're getting ready for the holidays. So I wanted to ask you guys before we get into the serious stuff, what's the best Christmas gift you ever gave and got? So Jason, start us off.
What do you mean? I'm Santa Claus. I'm the Christmas gift, the giver and taker. So best gift I ever got was I bought myself for this Christmas. I got myself a Peloton.
Oh, nice. All right, Tiffany, how about you?
I would say the best gift I ever gave are Washington Capitol hockey tickets to my kids and husband because they're giant fans. And then the best present I ever got would be a custom-made saddle from France because I like to jump horses.
Awesome, awesome. All right, Mark, how about you?
I think the best gift I ever gave, I built my daughter and her fiance, now husband, a custom-made queen-size bed. And best gift I ever got, I guess my 3 children.
I have to say that.
Bill, how about you? What about you?
Red Ryder BB gun, man, it was incredible. I almost shot my eye out though. All right, well, let's get into it. So this first story talks about thigh gap and how thigh procedures and thigh lightening has become the latest trend. I don't know, what do you think, Jason? Is that true?
I don't know. It's, you know, these stories come, they're searching for press. You know, they can't find enough to talk about besides who's doing this one and who's harassing this one. So, you know, look, women are always concerned about their thighs. You know, they care about the fat in their thighs. They care about the looses in their thighs. And now they're concerned about the color of their thighs. So I think it's all part and parcel of the rejuvenation that we do and the tools in our toolbox to correct all these things.
So Tiffany, what do you think? Well, I mean, what is thigh gap and what do you do for it?
I think it just depends on your specific anatomy. Obviously, liposuction is a great tool for women who are of relatively normal weight but have exercise and diet-resistant fat pockets. Sometimes it's just out of proportion, and no matter how much they work out and tone, it doesn't go away without some kind of surgical intervention. So it's great to have that tool in our toolbox, but we also have to be realistic about one's underlying anatomy and how much skin laxity there is and, you know, what their expectations are. Mark,
how about you? What do you think?
Well, I think women have always wanted the inner thighs to look good. And in the past, I've told them, I said, look, the inner thigh skin is just, it's loose. You have to deal with it. You can debulk it. You can make your jeans feel more comfortable when you put them on, but you're not going to do anything about that skin. And now we have skin tightening technology like the InMode Body Tighten. That's putting a whole new wrinkle on this. And now we can take it to the next level and debulk them with liposuction and get some skin tightening as well. So I think that this is going to accelerate the interest in this particular procedure.
All right, well, let's move on. So this next story was about this woman. She's from Hong Kong. She apparently had 30 procedures for her boyfriend. We're gonna stick with you, Mark. That doesn't sound like a good idea to me. What do you think?
Well, I don't want to be doing number 31. I mean, this is way off the bell curve and reminds me of that guy who wants to look like a Ken doll and the woman who wants to look like a Barbie doll. There's a certain part where it goes to some questionable psychological stability. And I think it's the surgeon's responsibility to be able to sort out and pick these people out. And certainly if someone comes to you with some issues like this and they haven't had more than a couple procedures, you might miss it. But if someone comes to your office and has had 20, 30 procedures, you got to look at this carefully and say, is this really the right thing to do?
Yeah, and then certainly, I mean, this is, I think they are talking 30 surgeries, you know, because if it's like 30 times you got Botox or fillers, you know, that's probably not necessarily a big deal, but, or 30 skincare treatments, you know, it's different things, but I think this is talking about surgery. I mean, you see some of these people, right, Tiffany, that just maybe doing things for the wrong reasons. Is doing it for your boyfriend a wrong reason?
I think it is. I mean, it sounds like she has a lot of regret after doing all of this, and she certainly attributes all of that decision toward having, you know, toward trying to make him happy or pleased with her when he was maybe overly critical. It makes me think of body dysmorphic disorder also, and it seems like it was the perfect storm for someone susceptible to that, who's with someone who's critical and asking her to do all these things to change herself for his happiness. You know, it all goes together, and it's not a great idea.
This is like normal. 30 surgeries is normal for people in Florida, right?
Absolutely. But you know what? You know, realistically, this is a softball question. You know, someone who's got 30 surgeries to look good for her boyfriend, you look at her and go, okay, this patient's crazy, right? Cray. You don't want her in your practice. But these are the ones that don't get you into trouble because you know they're crazy up front and you can get rid of them fast. It's the ones who sneak up on you, who haven't had 30 surgeries, who are crazy, and they catch you later. Those are the ones that are our trouble patients. This one, you see it coming up front.
All right, well, we'll say, I guess, stay tuned in this one and see how it works out for her. So we're going to move on. You know, this next story was really just came up. Our viewers were asking about this because it was about some marketing piece somebody put out, how this one surgeon was introducing somebody now to gummy bear breast implants, which I thought we'd abandon that term because it was a terrible term like 10 years ago. But Jason, I mean, lead us off. I mean, this gummy bear implants, there's nothing new about gummy bear implants. We don't even call it, we used to call them gummy bear implants like 8 years ago or 10 years ago, and we abandoned it. So, I mean,
you know, every consult day, patient comes in and says, I want gummy bear implants. Pretty much every single consult day. So what's my answer? They're all gummy bear implants now. I said, you know, the non-gummy bears were stuff we used to use a long time ago, and I show them an old implant. So they tell them they're all gummy bears, but then you got to get into the discussion of variable levels of cohesivity and yada, yada, yada from there. But this is just another guy looking for attention, trying to make a name for himself for something that we've been doing for 20 years already.
Yeah, I agree. I mean, we have different levels of cohesivity, which is great, depending on how much upper pole fullness one wants to maintain, or whether they want most of that lower pole fullness to be there and less upper pole. So it's not so much about a catchy term, gummy bear, which, by the way, I had to read that article and look at the date 7 times to understand that was a new press release, because you're right, it's been out forever. So yeah, it's more, you know, for me, I talk a lot at the beginning of the consultation about, you know, what kind of look are you hoping to achieve? What kind of look are you hoping to avoid? And and then, you know, we look at measurements and put all that together and figure out the right profile, the right height, the right style, the right level of cohesivity. So it's a lot more complicated than just coming in and saying, I want the gummy bear implant because my friend had that. There's more to it than that. So it's all about kind of educating the patient when they come in.
So Mark, I'm sure you had a lot to say about this, but certainly we've moved on from, that's almost like a dinosaur term now. There's so many different things, but you know, gummy bear doesn't mean anything, does it? Exactly. It's just a marketing term.
No, it's kind of archaic, and actually there's a lot of misnomers that keep getting propagated. Cohesivity is really a binary term, at least as I see it. It's either a substance is cohesive or not. Silicone's cohesive, saline's not. We're talking about really differences in viscosity, which is internal friction of the molecules of the silicone. And so now you're talking about a gradient, as Jason was saying. There's so many different types or degrees of viscosity of the silicone that we can pick an implant that has the characteristics that we want, as Tiffany said, to give, you know, a little more upper pole fullness, a little more lower pole fullness. I think this is a person who's just trying to fool the public and capitalize on the term, and there's really no substance to what he's selling except just misleading everyone.
Yeah, you know, it's funny because 15 years ago, because of how the regulatory stuff was in the U.S., there was a lot more different types of implants outside the U.S. And now actually we've gotten a bunch of approvals. We actually have implants they don't have anywhere else in the world. So now we have more implants than anybody else. And just like you said, Tiffany, it's like there's a lot of different choices, and you really need to go find somebody that's a real expert in it so they can really individualize what's going to work best for you, just like you said very eloquently. All right, well, let's go to our last topic. This is hot off the press today, and this was provided to us from Dr. Jason Posner. Jason, is on the cutting edge always, but this is about Allergan, who owns the CoolSculpting device, and they just got a new FDA approval for treatment of the double chin. So Jason, lead us off on this. What do you think?
So, this article is interesting because Allergan has had a CoolSculpting applicator for the neck. So we've been using that for a while. So the difference now is that they also are telling you that you get some skin tightening. So that's a good thing. We knew that with CoolSculpting, with the inflammatory response you got with the fat loss, you're going to get a little tightening of the skin. So they got their FDA approval, so they'll get some press, so there'll be some more people in your office. But the one thing that's worth talking about is that we all have a lot of options for neck fat these days. I mean, this is a good time to go into a plastic surgeon's office and ask for options from Kybella, which is an injection, to CoolSculpting, to regular liposuction, to facelifts, or maybe Mark will talk more about the the FaceTite applicator for InMode for those in-between patients. So there's lots of options available, and this hopefully will bring patients in our office, and we can then explain to them their different options.
So Tiffany, there has been a lot of different things now approved for the neck. You got this, you got the Kybella, you got other things. So what do you think? There seems to be a lot of people banking, and there's just a big, huge market of people out here that got submental fat, and are you seeing that in your practice?
Definitely. And it's nice to have a lot of options to be able to offer a patient. For instance, I find more men tend to come in thinking, I don't necessarily have to have surgery. I can get an injection, and, I'm not necessarily someone who would normally think about plastic surgery, but if it's just an injection, maybe I'll come in and talk a little bit about Kybella. They typically respond pretty well to that, but some people aren't candidates for that. So it's nice to have them come in and do a full evaluation. Like, is there skin laxity, or would it take a lot of expensive Kybella versus 1 or 2 treatments of CoolSculpting versus just one single downtime quick response liposuction procedure. So it's great that we have all these options, and a lot of these devices get a lot of press, and so it brings people in the door, and then we can evaluate them for the best procedure for them.
What do you think, Mark?
I think it's good to be able to offer patients all the options, because for some patients, one option is ideal, and for another, it isn't. And just a couple hours ago, I saw a 50-year-old police officer with a full neck and a little extra submental fullness come in, and we went through all the different options, and he chose to go with the liposuction and face type, because he wanted maximal result. But there are patients who definitely do not want anything surgical or even microinvasive, and they're going to opt for the CoolSculpting. The CoolSculpting, you have to be upfront, tell them the results are modest. You're not going to see a huge change. And then, with Kybella, it's expensive and there is an inflammatory reaction, but you can get some good results with that as well. Probably more than with CoolSculpting, maybe not as much as with surgery. So you got to be able to offer them all the options.
All right, that's awesome. Hey, you guys are true experts. Those are great insights. Our viewers are going to love it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.